The most challenging view of the FAST exam is the left upper quadrant, or the evaluation of the spleen. The mistakes people make are they don't have the correct position, they don't have their hand in the right location, they shoot the ultrasound beam with the wrong angle or in the wrong direction, and they're not persistent enough, because if you're trying to rule out free fluid, you really want to interrogate that spleen in its entirety. Remember that the spleen is typically smaller than the liver. Therefore, when you're shooting the left upper quadrant in the FAST exam, the typical rib interspace is going to be one higher or more cephalad than on the right upper quadrant view. And we're looking for dependent fluid. Therefore, your knuckles really need to be right on the bed, posterior in the patient, and the angle of your ultrasound beam needs to be pointed posterior as well. If you shoot it anterior towards the abdomen, or the anterior part of the abdomen, then you will get stomach, intestine in your view, and you're going to miss that free fluid collecting in the dependent portions. And if you're using a curvilinear probe, or just to have a patient that's very tight rib spaces, then try to shoot right in between them. And that might mean angling your curvilinear probe between the ribs and changing the angle of your transducer. However you get your view, make sure you see everything you need to see. So start either in the inferior pole of the kidney and work your way up towards the diaphragm, or start high up towards the diaphragm and work your way down. You want to see both poles of the spleen, both poles of the kidney, and above and below the diaphragm. In contrast to the right upper quadrant view, there's typically no potential space between the spleen and the kidney, so your free fluid is going to collect the poles and above the spleen. For more specifics, please check out our FAST instructional video.